Severe corneal chemical injury, acute steps. This is a video of a 50-year-old man who had an accidental chemical injury at home. You can see that the epithelium is almost completely lost and he almost has a total corneal epithelial defect. There is severe conjunctival chemosis. The vision is 6/60. There are decimase folds. And I'm not sure whether we can see some cells in the anterior chamber. The pupil is very small as well. Now, we really need to think about the acute management because chemical eye injuries are true ocular emergencies. The first hour of management even can be the difference between a full recovery and permanent visual loss. And so we need to start with copious irrigation, either saline or Ringer's lactate, and that needs to be done before you even examine the patient and definitely not delayed for any vision testing. So you can use a Morgan lens if available, or even a giving set if not. So you need to ensure that you invert both lids, sweep the fornices, remove any particulate matter, and that's especially important in alkali injuries where lime or cement granules can just continue causing damage. That whitish area that you're seeing there, you might wonder, is that an area of possible limbal ischemia? Look at that patchiness there. Quite tricky. So in terms of the management, in a patient like this, you really might want to consider whether the patient might need any topical steroids, intensive topical steroids to reduce inflammation. And you also need to give lubricants, but also prophylactic topical antibiotics, so chloramphenicol preservative-free 4 times a day. You also might want to consider giving doxycycline 100 milligrams orally twice a day because it's anti-collagenase properties, and that can be very helpful. But also vitamin C supplementation can be helpful too. So if there is significant limbal ischemia, then you might want to consider an amniotic membrane graft or even a limbal stem cell transplant might be used later down the line. So look, the thing I want you to remember here is ensure irrigation, check the pH, ensure that you give topical steroids intensively in the first 24 hours, and ensure that you look under the fornices to make sure that you've removed any potential other offending material that could be continuing to cause injury. And here we can see, look, there's conjunctival chemical injury as well, not just on the cornea. So make sure you do a full examination, and it will be difficult because it will be uncomfortable for the patient.